Welcome to the Family Assessment presentation for Nursing 334. The names in this presentation have been changed to respect the privacy of the family interviewed. The Friedman Family Assessment Model was used to conduct this family interview and assessment, as this framework provides a look at the family in terms of a larger community in which they are embedded. The structural functional theory was used to understand the family as an open social system, in which members interact with each other, as well as with members of other social systems. The systems theory approach was also used to emphasize how the whole family is greater than the sum of its parts. Looking at this family composition table, Homer is the father that works in instrumentation and electrical with an associate's degree. He is 26 years old and is married to Marjorie, who is 25 years old. She is currently not working, but working on obtaining her second bachelor's degree. Together, they have a 19-month-old daughter who attends daycare. This family genogram represents 3 generations. Abraham and Mona married and had 2 children, Homer and Abby. Abraham was previously overweight and abused alcohol. He no longer suffers from these conditions and enjoys a good relationship with his wife and children. Mona is a diabetic. Homer and Abby do not suffer from any health conditions. Moving to the right side of the genogram, Clancy and Jackie married and had Marjorie and Patty. Clancy has had previous bone fractures that are now well healed, and he does not suffer from any medical problems currently. Jackie is a diabetic and has osteoarthritis. Patty is pre-diabetic, and Marjorie suffered from childhood asthma without any current complications. Homer and Marjorie began dating in high school and married years later in 2020. Together they had Maggie, who suffers from eczema, a common skin condition in children. This ecomap shows relationships between the nuclear family and the community, as well as interactions between other important aspects of the family's life. The family has a normal connection to their local Catholic church. The direction of energy flows into church, as the family attends regularly, but reports no outstanding financial or emotional support from church. Moving down, one can see the family has a strong connection to Homer's work, since he spends much of his time and energy on his work and is compensated with financial means. Health maintenance is important to the family. Arrows of energy flow between both points as the family does its part to maintain health, and in return they live their lives without being hindered by any illnesses. A normal relationship line is shown here between the family and Maggie's daycare center. Energy flow is bidirectional, as Marjorie and Homer pay the daycare center and rely on it for childcare, and in return they are able to work and go to school knowing Maggie is taken care of. There is a strong bidirectional relationship between the family and Grandma Jackie, which is Marjorie's mother. Jackie provides childcare for Maggie 2 days per week. One can see that the relationship between Marjorie's schooling and the family is tense. Marjorie being in college full-time has changed the family's normal routine and level of income. Marjorie is putting energy into school but still has a bit to go before she earns her degree, shown by the arrow pointing from the family to Marjorie's schooling. Hunting is shown on the ecomap as well, representing Homer's deer hunting trips that typically last 1 week. Marjorie and Maggie stay home. All members of the family are challenged while being away from each other. Hunting shows an arrow pointing toward the family, as it gives Homer a sense of accomplishment and provides food for the family. There is an arrow away because of the energy and sacrifice Homer and Marjorie put into the hunting trip. Based on Duval's family development model, this family is in the second stage of family development. The family has surpassed the first stage, which is a married couple without children. This stage includes navigating how to live together and adjusting relationships with families and other social networks to include a partner. In the second stage, the family is considered a childbearing family with their oldest child between birth and 30 months old. The family agrees that they are preparing and adjusting the family system to accommodate children and developing roles as parents. The family, however, disagrees that they still are redefining roles with extended family members, and note that family member roles and caregivers are consistent. The family is currently transitioning from Duval's second to third stage as Maggie gets older. Marjorie and Homer agree that Maggie socializes with other children and the parents educate and guide Maggie. Parenting roles are also adjusted as Maggie ages, and Marjorie and Homer anticipate more children in the future. Marjorie and Homer are both functional senders in terms of communication. Both family members firmly and effectively state their point, position, or idea, and effectively communicate their feelings. Marjorie and Homer are able to clarify statements when there is ambiguity. Both Marjorie and Homer are also functional receivers of communication, meaning they are able to listen and give feedback appropriately. Marjorie and Homer are able to understand Maggie's wants and needs through her sounds, words, cries, and physical gestures. However, Maggie cannot always understand what her parents need. Maggie is a functional sender, but not a functional receiver for this reason. There is a secure attachment style between Maggie and her parents. She cries initially when dropped off at her caregivers, but soon enjoys herself shortly after. Some sarcasm is used in the home for comic effect or a sign of irritation, but effective and therapeutic communication heavily outweighs any negative patterns seen in Marjorie and Homer's communication style. The couple is affectionate toward each other and toward Maggie. The nuclear family maintains relationships with extended family members through communication and actively reaching out. Looking at power base within the family, both Homer and Marjorie are involved in making decisions about how resources and leisure time will be spent. Power roles are naturally assigned to each member as Marjorie and Homer carry out different functions in the home. Marjorie possesses referent power as she maintains relationships with families, interacts most with the community, and is a mother figure and role model to Maggie. Nuclear and extended family members have positive thoughts and feelings toward Marjorie, giving her status and power within the family. Homer possesses resource and expert power, since he provides a greater number of valued resources in the relationship at this time, including financial support, a consistent career, and hunting skills providing food for the family. The family displays syncretic forms of an egalitarian family, since they make joint decisions regarding all family decisions, such as Marjorie going back to school and relying on Homer to support the family financially for some period of time. This family also practices the autonomic form of egalitarianism, which decisions occur when members function independently. For example, Marjorie makes decisions for herself regarding school and childcare for Maggie without involving Homer sometimes. Homer fulfills the formal role of the provider. As discussed previously, he works full-time and provides food for the family by deer hunting. Homer is also the encourager in the family, or the one who praises, agrees with, and accepts the contribution of others. He is able to draw out other people and make them feel that their ideas are important and worth listening to. Marjorie fulfills the formal child care role. She is mainly responsible for organizing child care for Maggie. She is also the family's health leader and sets up doctor's appointments and dental exams for the family, ensures the family is up to date on vaccinations, and understands the importance of daily tasks to maintain health, such as hand washing and dental hygiene. Maggie is not old enough to have real responsibility or actively engage in role performance. However, she does fit the criteria of harmonizer. Maggie has the ability to mediate differences that exist between other members in the family simply by being present. Homer, Marjorie, and Maggie are Catholic and attend church almost every Sunday. Marjorie's dad is Baptist, and her sister attends a non-denominational church. Despite these differences in religion, there is no external conflict regarding religion in the family. Emotional and financial support between family members is common among the nuclear family and the extended family. For example, Marjorie's mom will unexpectedly pay for childcare every so often, or buy supplies for Maggie. Also, Marjorie will take her grandmother to doctor's appointments when her grandfather is unable to. Homer and Marjorie also cook meals and take them to their grandparents. The family also stressed the importance of having home-cooked family dinners for the sake of Maggie's health and upbringing. The family rated productivity and achievement, individualism, work ethic, education, fair treatment of others, and tolerance for diversity very highly when asked about family values. Lower rated items included materialism and the ability to succeed regardless of any obstacle. Overall, the nuclear family considers itself to be healthy. The family rated the importance of quality of life and health maintenance as a 5, based on a 0 through 5 Likert scale. Available to the family is a walk-in clinic 10 minutes away from the home. The nearest ER is 25 to 30 minutes away. The family travels 35 minutes to see Maggie's pediatrician, and Marjorie is also allowed to text Maggie's pediatrician if she needs to. Health insurance for Homer and Maggie through Homer's work is available, and Marjorie has health insurance through her mother's work, but this expires soon. so Marjorie will then be added to Homer's health insurance plan. Maggie is up to date on all of her vaccinations recommended by her pediatrician, and Marjorie is up to date on vaccines for school. Homer has not received recent vaccinations because his work does not require them, but he's not opposed to immunizations. All members of the family get adequate amounts of sleep. The family defines health as attending annual checkups, remaining active, and being free of medical conditions. The family defines illness as having mild sickness, such as the cold or flu. To search for health information, Marjorie looks online. She does not use any website in particular, but just sees what she can find. Marjorie's school has proven to be a significant stressor. Part of the stress comes from the workload of school itself, but on top of that, Marjorie has a husband and a little one at home to take care of. To cope with this stress, Marjorie makes sure she has childcare planned in advance. Another stressor in the family includes Marjorie experiencing the death of her aunt, whom she was close with. Her aunt passed away when Marjorie was only in the 7th grade. While this is no longer creating stress for Marjorie's nuclear family, it allowed Marjorie to empathize with Homer to help him cope with the loss of his grandfather, which occurred 2 years ago. This was the first real loss that Homer experienced. He relies on Marjorie and her empathy to cope with the stress and sadness from the loss. Also, when Homer was younger, his father Abraham drank excessively, and the two did not have a good relationship. Since then, Abraham has stopped drinking excessively and enjoys a nice relationship with Homer, Marjorie, and Maggie. Coping strategies Homer used growing up in response to his father's habits likely impact his reactions to stress and ability to cope today. This shows the actual NANDA diagnosis for the family, which is interrupted family processes related to Marjorie's role as a full-time student and mother. The goal includes that the family will achieve uninterrupted family processes within 6 months, as evidenced by continuation of family activities to promote cohesion and unity, having childcare planned for when Homer and Marjorie are at work or school, and Homer and Marjorie obtaining mutual and adequate support from each other. Goal 1 has not been met as the family spends less time performing leisure activities and misses church due to busy schedules. Goal 2 and 3 have been met through effective and therapeutic communication and showing affection toward one another. Interventions that could be implemented to achieve or maintain these goals include participation in family leisure activities 3 to 4 times a week, continuing to attend church 1 time a week, planning child care 1 to 2 months in advance when possible, maintaining affection between spouses, and maintaining or communicating the need for change in caregiver roles in regards to provider role, child care role, health leader role, kinship role, and therapeutic roles. The family also faces risk for caregiver role strain related to Homer's absence during hunting season. The primary goal is that the family will decrease risk of caregiver role strain within 1 month, as evidenced by Marjorie setting realistic expectations for task completion while Homer is out of town, Marjorie planning to receive extra help from extended family members in Homer's absence, and Homer accomplishing tasks prior to leaving on his hunting trip. Goals 1 and 2 have been achieved. Maggie plans on cooking less and holding off on unnecessary, non-urgent household chores during Homer's absence. Homer typically watches Maggie on Fridays, but will not be able to do so while he's gone on his hunting trip. Marjorie plans to take Maggie to her mom's an extra day per week while Homer is out of town. Goal 3 has not been achieved. Homer does not make any preparations for Marjorie and Maggie before leaving to go on his hunting trip. Interventions to meet or maintain these goals include preparing quick meals until Homer returns, prioritizing tasks and completing only necessary tasks until Homer returns, planning child care for Maggie from Marjorie's mother 1 to 2 additional days per week, maintaining effective and therapeutic communication between spouses, and having Homer prepare meals and complete household chores for Marjorie and Maggie before leaving on his trip. This concludes the family assessment presentation. Thank you for watching.